the National Institutes for Health, the human brain is revealing COVID secrets.
As you can see here, all these blood vessels are quite abnormal. You can see dark spots within the blood vessels.
Those dark spots that you're pointing at, those shouldn't be there?
They shouldn't be there.
Neurologist Dr. Avindra Nath is studying the brains of 30 people who died from COVID, but never had serious symptoms.
Most of them were found dead in bed. One person was found dead on a subway. Another person was just playing with his sister and fell down dead.
These are people that didn't have a lot of symptoms, or if any at all, and died suddenly.
Suddenly, that's correct.
I think most people who don't know much about COVID think about it as a virus that just affects the lungs. This tells an entirely different story, doesn't it?
Yes, you're absolutely right.
These brains, he says, could help answer one of the most perplexing mysteries of COVID-19. Why is it that long after the virus is gone, some people are suffering from symptoms that simply won't go away?
I didn't lose my sense of smell. I smelled burning all the time. Other things included brain fog. I would write the same sentence 6 or 7 times. I knew something wasn't right, but I didn't know what.
Carrie Kay Gibo was a healthy woman in her 30s a year ago when she first experienced a mild fever. It would take months and a positive antibody test before she realized she had COVID. Since, she hasn't been able to work. There were days when she couldn't even get out of bed. When she takes a shower, her heart rate jumps to 170. It feels like sprinting a mile.
You are not someone who was seriously affected by COVID in the beginning. You were never on supplementary oxygen, right?
Correct.
You never went to the hospital.
Nope.
You had what would be considered probably a minor case, right?
Yeah.
Now she is taking part in a massive billion-dollar initiative at NIH, studying tens of thousands of people to understand so-called long haulers.
We certainly are going to have to follow people for months and maybe years.
The NIH director says long haulers don't follow a pattern. Some were really sick at first, others weren't.
There's a lot that we don't know, but what are the central big questions you want answered through this study?
I want to understand how this virus causes an illness that you don't get better from the way you're supposed to. What is it? Have you done harm to the body by some sort of blood clotting problem, by an immune system that's gone haywire? We really don't know.
And the consequences could be felt long after the country is vaccinated.
When you consider we know 28 million people in the United States have had COVID, if even 1% of them have chronic long-term consequences, that's a whole lot of people, and we need to find out everything we can about how to help them.
I'm still struggling with of the exhaustion, random fevers.
Brain fog. The brain fog just won't go away.
Stairs are still not my friend. Just trying to catch my breath.
Can't keep your balance, dizzy, nauseous.
The NBC News medical unit surveyed 64 clinics across the country, just treating long haulers. Altogether, more than 10,000 people have been seen. There is no agreed upon treatment. Most patients are in their 40s, but there is a wide range.
It's totally disrupted everything about my life day to day. I never know how good I'm going to feel on a given day.
You know, my heart goes out to the people who are going through this. This has been already such a difficult experience. But you kind of thought, okay, if I get through this, then that's it. And to find out for some people, that's not it. That is cruel. That is just one more heartbreak that we didn't see coming. I promise you, we are all in on this. There will be no stones left unturned. We're going to figure it out.
Stephanie, we even hate to think about it, but is there a chance people could be dealing with these long-lasting symptoms for the rest of their lives?
Well, Lester, the hope is that identifying the cause will help treat the symptoms, but the neurologist who I spoke with said while the brain can repair some of this damage, it can't repair all of it.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.